And we looked at the workshop last week. We talked about lifestyle and we looked at exercises that we can do to help with back pain. So it's very much about strengthening the muscles around the spine, the stabilising muscles. So we talked about that last week. Today I want to carry on with the same thing. We still want to talk about back care, which is so important. But today is more of, I would like to focus on osteoporosis. And this is more and more common for people. And we used to think of it like years ago as it's like this elderly people, they used to get this osteoporosis, not the younger people. And more women of the age of, say, in their 30s and 40s are getting diagnosed with osteoporosis. And it's mainly because of lack of calcium that they have in our products. So milk doesn't have the amount of calcium it used to have years ago. And also people are not eating as many vegetables as they should be, which they've got a high portion of calcium, certainly within broccoli and spinach, just two examples. So yeah, if people don't eat a lot of vegetables, then yes, they've got a higher chance of getting osteoporosis. So what we really need to do is strengthen the muscles around the spine. Okay, so I'm going to begin with our posture, and posture important for everybody, for back care or not, for everybody in the world should be being concerned about back care. So first of all, feet are facing forward and the ankles are in line with the toes and the knees. We're going to stand up nice and tall. So always think about your shoulders back and down, so standing up nice and proud. Okay. Take your right hand onto your shoulders and just circle back. Okay. Now as you're circling back, I just want you to brace the abdominals, so fire them up, yeah? So a little connection there, and then the other side. And again, as you're firing up through the abdominals, I want you to take your mind around into your gluteal muscles. So again, lovely little contraction through the glutes. Okay, taking the arm down at the side of you. Take your right arm then, just circle that back, so a bigger range of movement. And then the other side. Okay, lovely. 1, 2, and 3. Now take your arms up into a Cossack Pose. We're going to do a small amount of rotation. So we're going to go over to the right side, look over to your right shoulder and centre, and then over to your left. So people with even osteoporosis can do this, yeah? We're going to tell you what they can't do in a moment. That small amounts of rotation through the spine is good. Okay, all right, lovely. So now I'm going to come through to the centre and block and take my arms down. I'm just going to drop my head, neck and shoulders, and I'm going to come into a forward flex position, okay? I'm only going to come down halfway. Just place my hands onto my knees, and then I'm going to roll back up. So people with osteoporosis, it's not really recommended that you come right the way down. So anything sort of forward flexing and adding in rotation is a no-go, all right? So this is okay. Just nice and gentle through the spine, hands onto the knees, and then roll it up. We can also CatCow with osteoporosis. So let's take our hands just down onto the knees and then draw up, as we know, into our cat stretch. So spine up to the sky and then away into your cow stretch. So perfectly safe for people with osteoporosis. And again, up we go and then away into our cow stretch. Okay, and coming up. So osteoporosis, a lot of forward flexion is not recommended, but half roll downs, absolutely fine. But what is recommended is to go into a back extension. We're sort of thinking more back than forward, okay? So come back into that back extension, other side. Push back, lovely. And again, so into that back extension. Take it back and the other side. All right, let's take both arms up with us now. So we're gonna come up, push back into that unsupported back extension, and again, up, lift, push back, and down. One more time as a bird, and then up, pushing it back, in and down. Let's roll it forward, only halfway, just to the knees. Come up into your cat, and then come down into your cow, and then come back up again. Take your arms up with you, float them up to the sky, and then come back into your back extension. Bring the arms down, fold them over right on top of left, and then go over into that Cossack Pose, over rotation to your right and left. Center, then change sides, yeah? So you're going to place your left arm on top of your right. Now we'll go to our left side. So go over to your left side, look over your left elbow, and then over to your right elbow, and into the center. Draw the arms down. Bend the knees, just give you a nice deep breath in and out. And again, squeeze down, deep breath in and out. All right, so legs nice and wide. Okay, just coming over into a lunge onto the right side and then over onto the left. Okay, and again, over to right and then over to the left. One more time. Over and through. Now go over to the right, okay, from here. Take your hands just to the side of your head and then bring your elbow down towards your knee. So lateral flexion, yes, stay on this side. 2 and 3, last time, and 4. Come up to center, straighten out the legs, draw down on the arms and give me 4 deep squats. 1 and then 2. Lovely. Really push back into those heels. 3 and again and 4. All right, now come over onto your left side, taking the arms up, elbow towards the left knee. So I'm going to come over, lovely lateral flexion. So the work is through the waist on the right side. So as I come down, my work is as I lift up. Yeah, one more time. Over and up. Bring it into the center, hands down, 4 deep squats. So that's it. So push down, and then as you lift up, think about taking the weight through the heels. Breathe in and take it up, breathe out. And again, down and up. Bring the feet together. Okay, I'm just going to pelvic tilt with you, all right? So just pushing my pelvis forward and back. Yeah, so if I show you sideways, so I'm going to just getting the spine, the lumbo-pelvic area moving. So in a nice, getting it all mobilized, yeah, waking up all the tendons and the ligaments. So let's moving it back and forth. So staying in sagittal plane at the moment, okay? And then I'm going to stop in my center, and then I'm going to go into frontal plane. So I'm just going to lift up. So again, think about sinking. So rib to ribs, bottom of the ribs, 12th rib to the top of the hip bone. That's it, lovely. And again, push up. Okay, and then placing the hands just onto the ribs, and that's for safety, yeah? So I don't want you to rotate is in this position. So hands onto the ribs, and then just rotate round. That's it, lovely. Moving from this powerhouse area, yeah? So it's not a hula hula, yeah? It's from here, round we go. Okay, so we do 2 in the opposite direction. And I'm going to do a little leg sequence with you, which is great for, again, not just about coordination, but just to get everything moving and everything that feeds into the pelvis, the femur, to start moving the femur in different planes. So to begin with, let's pick the leg up into a knee raise. So it's a knee raise and through. That's it. So up. And if you have a problem with balance, then you can hold on to something. If you've got a chair near you, hold on to that. Or just stay very close to the ground. Yes, it's just more of a tap. Let's add in an opposite arm. So I'm going to come up and 2. That's it, lovely. 3. Okay, now take it out to the side. So I'm going into my frontal plane. So keeping that shoulder. So as I take the arm up, keeping the shoulder down. And then 2 more. And then I'm going to go into posterior, into a hip extension. So I'm going to push. I'm just going to lift up the leg and squeeze the glutes, yeah? And again, perfectly safe for anybody with osteoporosis. Give me 2 more. So remember I said it's about strengthening the spine, the muscles, the deep stabilizers within the spine, and then come down to a squat. You just place your hands onto your thighs, but try not to push up with your hands, yeah? Let the legs do the work. 1 more. Okay, back to the top. So with our legs, we're going to come up and through, and the other side, and then out into frontal plane, so side abduction, and then the other side, then into hip extension, and then come into 2 little squats. I'm going to do that all onto the right leg. All right, so here we go. So we're going to go up, and then into the abduction, and hip extension, and then into 1 squat. Okay, and then the other side. So we're going to go up, into abduction, into that hip extension, and then into that little squat. Okay, bring the arms forward. So just roll it forward into back of the hands together and sweep it back, yeah? so you come forward. So really working through more about the mid to upper part of the spine. Up and through. One more time. So round we go and open. All right, and then over the top. So you take your arm over the top and then to the other side. Okay, and again, over and two. And then bring my right arm across my body to my left arm and then over the other way. And again, so 1 and 2. Right guys, take your hands down at the side of you. Just circle them back, breathe in and breathe out. Lovely. And again, breathe in and breathe out. Okay, we're going to go down onto the mat. So if you just get your mat out. And the mat exercises today, I'm going to be focusing on people with osteoporosis. Yeah? So the target is more about working with people who have that diagnosis. So to begin with, let's roll down together. Okay, so let's get down onto the mat safely. So looking down through to your mat, dropping your head, neck and shoulders, and then just roll it away. So walk away from you. To begin with, come into your calf stretch. Yeah, so as you may know in yoga, your down dog, heels down. Okay, I'm then going to come down towards the mat, so my knees are almost touching the mat. And then I'm going to lift up, back up to my down dog. All right, and then I'm going to come down, come out. I'm almost there. And then I'm going to come all the way down. So I'm on to all fours. So back strength work is really what is needed, as I said, really getting into those deep stabilizer muscles. So Superman, so we can come out with the arms, so arm extension. Again, keeping this pelvis and your spine nice and still, bracing the abdominals, and then just move down to the lower body, to the legs. So go into a leg extension, and in, and then the other side. Okay, and again. So very much sagittal plane dominant at the moment, and better for people with this condition. So let's go into our opposites. So I'm going to lift up with my right arm and my left leg, and bring that in. So Superman is absolutely fine. Yeah, and again. So plant and lift, and in, and then plant and lift, and in. Lovely. Okay, from here, just walk the hands away from you, and I'm going to go into a few little press-ups before we come down into prone. So press-ups, Pilates press-up, and up, yeah? So I can drop my chest down towards the mat, and then I'm going to lift back up. Okay, so great shoulder strengthening work. Down and lift, keeping the elbows in, into that Pilates press up. Okay, come back into a child's pose. And then over we go. Okay, if you come down now onto your tummy, yeah, come down lying down flat onto the tummy. And if you place your hands just at the side of you into a square position, and we can just lift up. So just lift away and lower, and then the other side, lifting and lowering. And again, so lift up, little rotation through, it's absolutely fine. Okay, one more time, and then we can go into our swimming. So for swimming, I'm going to extend my arms, I'm going to take my right arm up and my left leg, and then my left arm up and my right leg. Yeah, so into swimming. So again, strengthening through the glutes, and as I said, the muscles around the spine. Up we go, and up and through. Okay, bring your hands just at the side of you, and then come back. Now, CatCow is perfectly safe as well. So we did it standing. We can also do it onto the mat. So drawing the spine up to the sky, and then into your cow stretch. And again, the sun is coming out. There we go. Into your cat stretch, and then into your cow stretch. Okay, so just come into a seated position a moment. Right, so anything that requires rolling through the spine, so it's a half roll back, or into a full roll back, yeah, into that, or anything so rolling like a ball, anything like that, people with osteoporosis is a no. It's an area we don't go, because the spine is very weak, and you could actually sort of do a little fracture, a tiny little fracture in the spine by rolling over it, yeah? So if you have a diagnosis of osteoporosis, there's absolutely no rolling. But that doesn't mean that we can't work our tummy muscles and our deep core muscles. So if we just come back into a lion position, yeah, if you just come back into the lion position and just finding that finding that neutral position. So bringing your knees in and your feet flat onto your mat, and then just roll through. Yeah, so just pelvic tilting like we did when we were standing. So coming forward and back. Okay. And it depends on the severity of osteoporosis, but it depends obviously on the percentage. So you'd get it from the doctor or the hospital, the percentage of osteoporosis that you have. But anything sort of shoulder standing could possibly be a no-go. Again, it depends on the scale. So really good, just a sort of pelvic tilt. Okay, and another really good exercise is your tabletops. Okay, tabletop tap down. So you come up, brace the abdominals, lifting up through into that tabletop position. Okay, and then you could come up, putting into tabletop. Okay, again, brace the abdominals, and then from here just tap down. So tap down. That's it. Lovely. And you can do it in this position. You could also add in, if you wanted to, you could add into the dead bug, so the arms are up extended, and then you could use your arms as you could go back and just sort of go into opposite arms. That's it, opposite. And again, two more. 1 and 2. Okay. Drop the arms down at the side of you. You could go into a leg extension. Again, spine nice and flat onto the mat, comfortable as you work through the lower abdominals. Yeah, there we go. And then from there, we could change it to bicycle. Again, very safe, nothing moving. Again, lumbopelvic area, just keeping it nice and still. Okay. 3, 2, and 1. And then from here, just bring the knees in, which is perfectly safe. Okay, we're going to go into scissor. So I'm going to bring my head, neck and shoulders away from the mat, extend my right leg, and take my left leg away. Okay, and there from here, I'm going to do scissors. So I'm going to drop and lift. Yeah, and again, drop and lift. So the higher up you are, the harder it is. So I'm going to do it with a little pulse to make it a bit harder. So I'm going to do pulse, pulse, and change. Yeah, pulse, pulse, change. And again, pulse, pulse, change. And again, 1, 2, change. All right, and bring that in, take it back down. Okay, and there you go, into your little knee roll. Take your hands out to the side of you and allow the legs just to drop over one side. Okay, so as I said, we need to be restricted on rotation. So this is fine, yeah, because you're into frontal plane. So keeping it nice and low. So keeping the feet down onto the mat rather than into a knee rolling position from tabletop. So this is much safer for osteoporosis people than this, okay? So this, a no-go. We're going to take it down, feet down, and then you're going to roll off side to side. Again, it really depends on the severity, as I said earlier, of this osteoporosis, and how fit you are as well. So you've been doing lots of Pilates and yoga and cardiovascular exercises, and you can do a lot more than a beginner. Okay, hold that there, guys, hold that there. Take the legs away from you and just stretch the arms up above the head, and just give yourself a full body stretch. From here, just roll it over onto your side, coming over onto your side, rolling over to the front, and then coming up onto all fours. Okay, so from this position, tuck your toes underneath, pop yourself back up into your down dog position, into your calf stretch, then coming down towards the knees, so the knees are towards the mat, and then back up into your calf stretch. Lovely. Come down towards the mat, all the way down to your knees. Take your feet away from the mat and then open the arms. So you can get a little bit more challenging now with the exercises. Yeah, so rather than basic Superman, taking the feet away makes a huge difference on the core stabilizers. 2 more. Up we go. Last one and through. Okay, guys, we're going to come back up to standing. So I'm going to pop my feet down. I'm going to tip up into my down dog position, and I'm going to walk my hands back in towards my feet, and I'm going to roll it up to the top, taking my shoulders back and down. Okay guys, I hope you enjoyed that today. As I said, it was a little sort of snippet of what we can do for back pain, back care, and also just bringing in something else, as I said, more and more common now, especially with women in their 30s and 40s, osteoporosis. If you've got any questions, and just fire away and let me know, just drop me a line, and just brilliant.